Assalamualaikum and salam sejahtera. My name is Dr. Eli Zarina Samsudin and I'm a public health specialist and senior lecturer of public health medicine in Faculty of Medicine UiTM. The topic I will be giving now is common musculoskeletal disorders associated with computer workstation. Work-related musculoskeletal disorders has become a common occupational health issue in workplaces globally, including Malaysia. According to a recent systematic review by Demisi et al., the prevalence of MSDs among computer users varies widely, ranging from 34% and reaching up to 95%. Indeed, Malaysian office workers often complain of MSD symptoms, including neck, shoulder, and lower back pain, as shown by previous studies. Prolonged use of computers can lead to symptoms such as neck, back, shoulder, hand, and wrist pain, and conditions including tendinitis, nerve disorders, joint and muscle disorders. Many computer users also suffer from visual discomfort and headaches from glare and intense use of the eye. Finally, computer work has also been associated with an increased risk of diabetes, cancer, and overall mortality due to prolonged sitting. Let us look at how work-related hazards can contribute to work-related musculoskeletal disorders. Work-related musculoskeletal disorders is a multifactorial disease. When workers are exposed to workplace conditions such as biomechanical hazards, negative psychosocial and organizational workplace characteristics, and have pre-existing individual risk factors, it may cause high internal biomechanical loads and fatigue. This then produces a stress response, which leads to discomfort, pain, and tissue damage, and ultimately result in work-related musculoskeletal disorders among workers. These are some risk factors for work-related musculoskeletal disorders. Workers exposed to biomechanical hazards such as repetitive motion, static loading, awkward posture, contact stress, and excessive force are at risk of developing work-related musculoskeletal disorders. We will expand on these risk factors in more detail in the following slides. In addition, workplace characteristics such as high levels of job stress and lack of ergonomic training may increase the odds of work-related musculoskeletal disorders among workers. In terms of individual factors, workers who are older, female, and have low physical fitness are more likely to develop work-related musculoskeletal disorders when they are exposed to biomechanical hazards in the workplace. With regards to biomechanical risk factors mentioned earlier, repetitive motion is performing the same or similar motions repeatedly. This can result in trauma to the joints and surrounding tissue. If there is insufficient time for rest and recovery, this repetition can lead to injury. Computer tasks that may cause repetitive motion may include typing at the keyboard, moving and clicking the mouse, and looking back and forth between the monitor and source document. On the other hand, static loading happens where the muscles must hold the body in a single position for a long period of time. This lack of movement reduces circulation and causes muscle tension, which can contribute to or aggravate an injury. Computer tasks that can lead to static loading may include holding the hands in place above the keyboard or mouse, keeping the head still while reading from the monitor, and sitting still for long periods of time. Meanwhile, postures that bend the joints into positions where they are more likely to become injured are termed awkward postures. Computer tasks that can cause awkward postures may include typing with bent wrists, reaching over the keyboard to use the mouse, and leaning over to type in data from papers laying flat on the desk. On the other hand, contact stress occurs when a hard or sharp surface or object presses into the soft tissues. When this happens, this can cause damage that over time can result in serious injury to the tendons, nerves, and blood vessels. Computer tasks that can lead to contact stress include resting wrists on the desk edge while typing, leaning the elbows on hard chair armrests or work surfaces, and typing with the palms resting on top of a keyboard tray. Finally, many office tasks require a moderate amount of force to be applied by muscles, which may cause fatigue, swelling, muscle strains, and ligament strains. Computer tasks that can produce force may include dragging and dropping with the mouse, gripping the sides of the mouse tightly, and pounding on the keyboard. For each of the risk factors mentioned before, a longer duration of exposure results in a greater potential for injury. Complaints of discomfort and reports of injury are higher for workers who spend 6 or more hours a day doing repetitive data entry compared to those who only spend an average of 2 hours per day doing the same task. Combinations of risk factors associated with one task further increase the likelihood of work-related musculoskeletal disorders. For example, repetitive keyboard use has been shown to be more likely to result in a work-related musculoskeletal disorder when more force than is necessary is used on the keys. Environmental factors such as lighting, temperature, noise, and organizational factors such as job design and work schedules can increase stress-induced physiological changes that can increase the risk of injury. Finally, individual risk factors such as predisposing medical conditions can also increase the risk of work-related musculoskeletal disorders by causing swelling in the joints, such as with fluid retention during pregnancy. That is all for this presentation. Thank you for your attention.